And so our next presenter is going to bring you a personal story, a story in order to make what we're trying to do come alive for you. So Pippa Breakspear is a chemical dependence counselor in a private practice here in Bellingham. She's worked in many different arenas in the area of chemical dependencies, social detox, drug court, the Whatcom County Jail. But she's also an extremely creative person and has written a series of monologues. And she's going to share with you one of her monologues called Junkies Like Me, From Pain to Addiction. So please welcome Pippa Breakspear.
Good morning, everybody. It's lovely to be here. Thank you, Marie and Katie and Carola, for everything you've done to organize this. So, years ago, I went to a pain specialist for chronic back pain, and at my first appointment, I was prescribed OxyContin. It was marvelous. Pain gone. I got sober a decade earlier, so I took it as prescribed. I didn't abuse it, and I didn't get high. A few months later, my handbag was stolen with my meds in it, and that night I went into withdrawal. I was writhing around in bed, muscles cramping, intense pain throughout my body. I didn't know what was happening. I found out why it's called kicking, because that's what your legs do, is you try to alleviate the extreme pain in your muscles and joints. Nausea, vomiting, diarrhea, acute depression and anxiety that lasted for months. I was totally freaked out by the whole thing, and I quit taking it. Opiate addiction is a very physical dependence. It's different from other drugs. It's not just the psychological craving. It's the physical dependence. It's the acute physical pain that accompanies withdrawal and detox that overwhelms sincere efforts to quit. Coke, crack, meth, alcohol, they don't do that. Opioid withdrawal has been likened to a bad case of the flu, not even close. It's horrendous. It freaked me out, so I stopped. Then years later, having had chronic migraines forever that didn't respond to treatment, I was prescribed Vicodin to take as needed. I was a single mom, raising 2 kids, going to school full-time, working. I was overscheduled, I was overwhelmed, but I took my Vicodin as prescribed, until I didn't. I really started to love that warm, smooth, chill feeling. It was like a couple of hours of bliss, a mini vacay, like being wrapped up in a blanket of God love. There's a lot of you here, it's a bit nerve-wracking. How could I forget this? I was interning at a rehab facility at the time, getting my chemical dependency license. I'm getting high. And just a year away from finishing my master's. And I compromised it all to pursue that delicious high. Insane, right? But a ton of people like me end up getting addicted who've been given a legitimate pain prescription. And if your brain likes that shit, watch out. Because 75% of heroin addicts start out this way. Never assume you know what a junkie looks like. We look like everyone. I followed the Department of Health's treatment plan and went back to AA meetings, a lot of them, which I'd attended for years, having got sober in the early 90s. I had less sobriety in the room than people who had been my clients, as I learned that you can't save your ass and your face at the same time. I didn't relapse, and I now have a healthy fear of opioids and a lot of gratitude. I used a combination of acupuncture, cognitive behavioral therapy, meditation and mindfulness, non-narcotic medication, and later cannabidiol, CBD, the non-psychoactive part of the marijuana plant. Yeah, we need more data on cannabis, I get it. It's hard to get as the FDA maintains its Schedule I status. Don't even get me started, it's so stupid. Which is really ironic considering they just approved it for the use by children, for seizures as a result of epilepsy. But But there's plenty of accurate data online now, and every dispensary has to have a medical consultant on the floor available at all times. They're very well informed, so talk to them. Marijuana, cannabis, is a plant, it's not a drug, it's a medicine, and it's got a really bad rap. And it's definitely a viable alternative to opioids. Not that I'm in a position to make recommendations, so of course I'm not. Pharmaceutical opioids are expensive on the street, and heroin, worse yet, fentanyl, is much cheaper. Many smoke it at first, and then tolerance builds, and some start to inject, using as much as they can without overdosing, barely getting high, but staying out of withdrawal. Every day is devoted to finding money to buy dope, to use, to find more money, to buy dope. And that goes on, and you can't stop. And yes, hell is a thing. The root word of addiction is adico, which means to be enslaved or devoted to. And every addict can relate to this. Many developed countries support harm reduction strategies and decriminalizing drug possession for personal use, which actually reduces drug use and crime, overdoses, HIV, and Hep C. However, the US is reluctant to follow suit, probably comes as a shock. In spite of the favorable data, we're addicted to the punitive model. We still spend $50 billion a year on the war on drug addicts. We treat addiction like a moral failing, driven by our unethical, racist, and antiquated drug laws, which makes it almost impossible for some people to succeed. But at least we now have needle exchange programs, easy availability of Narcan, a nasal spray which reduces an overdose, a much better understanding of the brain, and opioid medication-assisted treatment using methadone and Suboxone, which is prescribed and carefully monitored, which doesn't provide the same euphoric high as other opioids, and eliminates the criminal activity necessary to get drugs. So patients can start to stabilize their lives. And yes, it has its own set of problems, but studies show that this approach reduces deaths by nearly 50%. And if you don't reduce those, then you've got a load of dead drug addicts on your hand, you can't help them. Currently, the most recent numbers from the CDC are that 180 people are dying every day from opioid dependence and addiction. The epidemic exploded in the 90s when Purdue Pharmaceutical began aggressively marketing and distributing OxyContin, claiming it was abuse-resistant with a low potential for addiction. In 2007, they were sued for being total lying sociopathic assholes. That's a clinical term. For completely misbranding a highly addictive drug. They pled guilty, paid $700 million in fines, and nobody went to jail. Well, only drug addicts and drug dealers go to jail, right? Wait, what? Why not? Well, because they have over 1,400 pharmaceutical lobbyists behind them, unlimited funds, and, oh right, they're white and they're wealthy. There are multiple lawsuits pending against Purdue, which they always settle, accept no responsibility, and blame the addicts and distributors. And they're now using exactly the same strategies abroad that created the opioid epidemic here. Multiple pharmaceutical companies who manufacture Suboxone, fentanyl, and Narcan are also being sued for their unethical business practices. Talk about an epidemic. These companies are literally making billions from the opioid epidemic. In the US, we consume more opioids by far than any other country. Why? Well, insurance often won't cover alternative therapies like acupuncture or physical therapy, so pain medication is often the go-to solution. We've become very accustomed to there must be a pill for that. The US and New Zealand are the only two countries in the world who allow prescription drugs to be advertised on television. And doctors receive regular visits, incentives, gifts, and trips from pharmaceutical reps who studies show have significantly influenced their prescribing practices. I don't want to offend anybody here, but medical professionals are sometimes underinformed about addiction. And when drug abuse is detected, particularly of patients prescribed medication, and I understand the liability there, That's why patients on controlled substances need to be monitored by urinalysis and held accountable. But they're often discharged without any referral to an addiction specialist. So there is a list of local facilities in Whatcom County in your packet for any referrals. And it's really hard not to take it personally when your patient or your client, your friend or family member manipulates you and lies. But lying is the first symptom of addiction. You gotta be a good liar to be an efficient drug addict. It's not personal, it's addiction, which is best described as a craving, followed by use, a brief experience of pleasure or relief, and then ongoing use in spite of increasing negative consequences. But if we're held accountable with as much respect and kindness as possible and experience the natural consequences of our behavior, the sooner we get help. Which doesn't happen if we're enabled or rescued or bailed out. But shaming and blaming never helped anyone. It actually adds to the problem. Approximately 57 million people in the US are abusing drugs and alcohol as a way to distract, mute, manage, or cope. And that doesn't include tobacco, porn, screens, sugar, social media, Netflix, and all the folks who gamble and overshop and overeat and overwork. Addiction is a treatable, not curable, relapsing condition. Like lots of others, heart disease, hypertension, cancer, asthma, mental illness, being married. Doesn't that put addiction square in the middle of normal human behavior? Can we just stop shaming and blaming the people who have it for having it and accept that relapsing conditions need ongoing treatment? We don't blame sun worshippers for their unhealthy behavior or abandon high-risk adventure junkies and athletes stranded or lost with a, well, you brought this on yourself, so, too bad, so sad. What if your melanoma went into remission and then you found another lesion and you went to your oncologist and the oncologist said, really? Why have you let this happen again? This is the third time. I think you need to go to jail. It sounds ridiculous, right? But that's exactly what we do with addiction. And only 10% of people in this country who ask for treatment actually get it. Effective rehab is rarely accessible to middle and low-income people. Recovery is a tough road, and relapse is a harsh teacher, and not everyone makes it. We're spiritual beings having a human experience. It can be insanely challenging. Addicts, we're smart, we're funny, emotional, highly sensitive, creative, compassionate, and often infuriating humans who commonly struggle with depression, anxiety, trauma, and post-traumatic stress. Some drugs can seem more effective than traditional psych drugs. Alcohol numbed my depression very effectively for well over a decade. Nobody means to get addicted. It's a brutal lifestyle, a form of possession, a ravenous beast that demands to be fed. We judge so harshly until it comes knocking at our door. A husband, a daughter, a close friend humanizes this condition. Addiction is brutal. You can hate it. I do. But can we love and respect and treat the people who have it? Thank you.